Hello, you're welcome again to yet another session. Um this is AKT preparation tutorials, and if this is your first time of attending a lecture or listening to a recording, we're just trying to make basic summaries of the most important topics in AKT, and this is neurology. And I've covered some of the topics in neurology. If you have not listened to them, it will be good if you can get the tape. So today we're covering dementia. We're talking about dementia today. Okay, dementia is a very very important topic. It's a condition that is prevalent. It's very prevalent in the elderly population. So what is dementia? Dementia itself is a name for a group of symptoms that commonly include problems with memory, thinking, problem solving, language, and perceptions. In itself, dementia is not a disease, and it is not a part of aging. The symptoms of dementia are caused by disease that affect the brain, and it is a progressive condition which is due to loss of the nerve cells in the brain. The symptoms gradually get worse because as the cells die, they cannot be replaced. So essentially, here I have this table, and we're just going to look at this table in which I've tried to summarize the types of dementia we have. And with this table, I'm going to try to outline some of the questions you might come across in whichever exams you're writing. Okay, so we've said that dementia itself is a group of symptoms that commonly include problems with memory, thinking, problem solving, language, and perception. So, what are the causes of dementia? Based on the causes of dementia, I've tried to divide dementia into the following groups. We have Alzheimer's dementia, we have Parkinson's disease, we have Lewy body dementia, frontotemporal dementia, vascular dementia, Huntington's disease, and normal pressure hydrocephalus. If you listen to my tape on other movement disorders, I talked extensively about Huntington's disease and normal pressure hydrocephalus, which are usually have the movement disorder component. The reason why I've brought them here is I want to contrast them with the other causes of dementia, because usually what you have in the exam is they give you a question, they try to paint a scenario, they give you a constellation of symptoms and ask you the diagnosis. So that's why I brought it here, so that we can do a lot of contrasting. Okay, now we're going to start with Alzheimer's dementia. Alzheimer's dementia. Usually it is characterized by memory loss, which is example, the person finds it difficult to remember names and things that have to do with recent memory. Also, there's problem with language, aphasia, apraxia. Okay, so I won't say much about Alzheimer's dementia. We usually have a lot of questions come under Alzheimer's. The question is, you might ask, they might paint a scenario of an elderly patient. You get with memory loss, recent memory loss, problems with names, aphasia, and they just paint a scenario of Alzheimer's dementia and they ask you, what is the management? Okay, what medication do we use? The medications used at the moment in Alzheimer's dementia include donepezil and memantine. You get, okay? For example, to talk about memantine is an NMDA antagonist. It's an N-methyl D-aspartate antagonist. Because it's possible to have a question in which they will ask, what is the mechanism of action of memantine? So it's an NMDA antagonist. That is N-methyl D-aspartate antagonist. And that is why I've put it in thick. I've had a few questions on the mechanism of action of memantine. Okay. Also, a couple of questions on what medication will I use if I'm suspecting Alzheimer's dementia. Okay. Now, the second group is the cholinesterase inhibitors, and that is donepezil. These medications are used in dementia. Well, personally, I doubt their success though, but they are used. Okay. So now, Parkinson's disease is another form of dementia. Parkinson's disease is associated with dementia. Essentially, if you listen to my last lecture, my last tutorial discussion, we know that Parkinson's disease is predominantly a motor disease, but it is also associated with memory loss. I'll put this here just to remind us. I've told you that Parkinson's disease comes with tremors, resting tremors, rigidity, and bradykinesia. Okay, and during my last lecture, I talked about the medications we use, the dopamine precursor, L-dopa, given together with carbidopa. I mentioned about dopamine agonist, bromocriptine, pramipexole, the MAO inhibitors, seleginine, the catecholomethyltransferase inhibitors, entacapone, and the muscarinic antagonist, benztropine. So those are the medications we use. The thing to remember about Parkinson's disease is that the movement part of it is predominantly a motor disease. So you have a disease starting with tremors, rigidity, bradykinesia. Very, 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 very important in Parkinson's disease. Okay, memory loss can occur down the line. You see, so with that, I would like to contrast Parkinson's disease with Lewy body dementia. Okay, Lewy body dementia is characterized by visual hallucinations and increased tone tremor, and problems with cognition. Okay, so now the interesting thing about sorry, I would like to put this in tick because it's very, very important. Okay. Yeah. The interesting thing about Lewy body dementia is that dementia occurs before or at the same time as the motor symptoms. So see that dementia comes before the motor symptoms, or dementia comes before the motor symptoms. Whereas in case of Parkinson's disease, you have the motor symptoms coming first. That is why I've put it in tick here so that we can contrast with Parkinson's disease. You know, I'm highlighting most of the questions. What are the things they want to check? And these are the things I've put in tick. They want to check dementia, the memory loss, the memory problem before or same times as motor problems. In contrast to Parkinson's disease, in which you have the motor symptoms most commonly coming before the memory problems. Okay, very important to be able to differentiate between Parkinson's disease and Lewy body dementia. Then we have the frontotemporal dementia. Okay, frontotemporal dementia, we have problems with socially inappropriate behavior utterances, poor executive function, then decreased motivation. You see, so and the treatment is, most of the time we try to treat the depression that is associated with frontotemporal dementia. Okay, very important, vascular dementia. Vascular dementia, it's very important for us to know that in vascular dementia, we have stepwise decline, and it's usually due to stroke or due to problems with the blood vessels. So you have a patient, the patient has an insult to the brain. You know, it affects the memory in a way. It's stable like that for some time, Then there's another insult. Then it goes down again. It stays at that point for some time. Then there's an insult again. Then it goes down. So there's a stepwise decline in the patient's memory due to repeated insult. It's very, very important. You might have a scenario about a patient who had an insult, deteriorated, had another insult, got worse. And that is why when you do the imaging, what you find is ischemic damage. And how do you treat this? Essentially, it is important to prevent this by treating hypertension and treating diabetes mellitus. Okay, I will not dwell too long on Huntington disease because I discussed it in my last lecture. Okay, also the same thing with normal pressure hydrocephalus. It is important to know that both Huntington disease and normal pressure hydrocephalus are associated with dementia. Okay, now in Huntington disease, don't forget you have the choreiform movement, which is dancing like movement. You have the dementia and you have the behavioral changes. So in the exam, you might have a patient, they tell you he has issues with movement of the body, dancing like choreiform movement. He has memory issues. He also has behavioral issues. That is Huntington disease. Then again, another condition we need to know very, very closely. We need to know the constellation of symptoms in normal pressure hydrocephalus. What happens in normal pressure hydrocephalus is you have a patient with gait abnormalities, having problem with mobility. You might paint a scenario of an elderly man, problems with mobility. He also has some memory loss and he also has urinary incontinence. When you see this constellation of symptoms, the answer is normal pressure hydrocephalus. Okay, so in summary, it is very, very important for us to be able to identify, to know the differences between all these forms of dementia. You need to know the difference between the constellation of symptoms. Can I differentiate Huntington disease, normal pressure hydrocephalus? What about Lewy dementia? So it is very, very important. So thank you very much. That will be all for dementia, and I will meet you in the next lecture. Thank you.